I knew that I wanted to be in some type of medical career where I was taking care of people and directly involved in listening to people and helping solve problems, and really being involved in the part of a person's life where they needed help. And then through my medical school and my internship training, I was really drawn to oncology because I just saw the struggle that a lot of people were going through, but the hope shining through, and I really loved being part of that journey that patients were going through. And there's a lot of hope that we're seeing more and more now than we've ever had before, and I'm so happy to be part of it. I primarily specialize in breast medical oncology and gynecologic oncology, medical oncology. And I'd like to think that what sets me aside is that I really try to listen to patients and take the time to give them top-notch standard of care, but tailor it so that they're getting that personalized attention and care that they deserved. My approach to patient care is to be open to listen to patients and meet them where they're at. I always try to expedite their care if they are ready to move things along, because for many people, the waiting is the hardest part. And a lot of people getting a plan and getting things moving along and knowing that they're starting the fight is what makes them feel like they have that comfort knowing that they're getting on care and starting the path towards cure. But it's also really important to listen to people and know where they're at in that whole process. So I try to listen, but most of the time people are ready to get moving and get their studies done, whatever that may be. I chose UNC Health because we have everything you need to provide top-notch standard of care, excellent service, but it's in a smaller setting where people aren't coming in, waiting, having to deal with terrible parking situations and having to wait for a long time that you can sometimes have if you're traveling to a major medical center, and where you might sometimes feel like you're not getting the personalized care that you want. And I wanted to be able to focus my career on taking care of people, but also making sure that they had access to clinical trials. And here we have access to clinical trials that are being offered through the major medical centers, but patients for the most part aren't having to travel far for that. We're able to offer most of the clinical trials right here. So people are getting such top-notch care so close to home. And I think that matters a lot, because when you're getting treatment with chemotherapy, whether it be oral chemotherapy or IV chemotherapy, sometimes if you're not feeling well and there's something that's a complication, you want to be able to just have someone get you in the car and come in and get taken care of. You don't want to have to drive a long distance. I think these days there's a lot of, patients have a lot of access to information. And I want patients to know that if you're getting information and you want to know if that's accurate and it's raising questions about what you should be doing and raising questions about your care, feel free to ask about it, because I know that it can be confusing with all the information you can get out there online and from other people can get very confusing. And so I'd like people to feel comfortable bringing any of those questions to me. I also feel that a lot of people more and more these days are doing some type of homeopathic or alternative care. And I hope that people would feel comfortable talking to me about what they're doing, so that we can incorporate that when it's safe, and we can screen what they might be doing in terms of complementary care, so that they don't feel like they're having to do something on the side and not share that with me, and feel in any way that I wouldn't be open to that as long as it's safe. When I was growing up, one of my greatest experiences was that I was an exchange student in Indonesia for a year and lived with a family there and went to school there for a year. And it really opened my eyes to the world. And I also lived in Japan with a family for a half a year and found that to be a wonderful experience as well. And other personal things about me would be that I'm now an empty nester, and to my surprise, I'm really enjoying that because I have more free time, and I'm using my free time to try to get outside and exercise in the fresh air.